Well, hello and welcome, everybody. I am Gustavo Tolosa, your host for this book club that we have every Saturday. Today, I am broadcasting live through two different platforms. One is our usual Webinar Jam platform for webinars, and the other one is YouTube, which is the camera that I have here. So if you see me looking here sometimes and looking here sometimes, it's because I want to look at both of you. I want to mention that I have a lot of free resources, a lot, and I don't know if you're aware of that, but my YouTube channel, which is under my name, Gustavo Tolosa, has hundreds of videos with different doctors and chefs, and there are some videos of me playing the piano, and so just make sure that you visit it and that you subscribe to it, because there's a lot of really, really good free material there. There's also free resources in my Facebook page, which is Dr. Starch, all spelled out, recipes, articles, videos, things like that. There are some other resources in my website, which is plantemas.com, plant, PLANTEMUS.com. And so just explore that, because most of what I do is free, because I want to help you, all of you, really. That is my mission. And I do have a few paid webinars that help me with the free webinar. So you can always email me. My email is info@plantemus.com, PLANTEMUS, .com. And if you like to hear me play more, go to my website, which is gustavotolosa.com. I have an online concert coming up on November 21st. So make sure that you register for that. You can email me if you cannot find the link. And one more announcement as I wait for people to join us. I do give piano lessons online. So if anybody wants to take lessons, please let me know. If you want to take any other lessons that is not piano, I'll set you up with a teacher at the Dallas Music Academy. And so some of the paid shows that I have some exclusive recipes that are really, really awesome, like the gnocchi that is all potato based, and the polenta that my grandmother used to make, and the paella that she also used to make. And they're now all plant-based, whole food plant-based, all free, SOS free. And so that is part of what I do. So what I do is I like to find new things. I like to find innovative ways to help you stay compliant and to succeed, but also have fun as you do it. So I created a show that is called The Pianist and the Chef, in which I present really good recipes, and I introduce you to people, family, friends in my life. Sometimes I will take you out into the mountain town, and then I give you a mini concert at the end. So that's The Pianist and the Chef, and there are 3 episodes which you can find on plantemus.com, or you can email me. And I also have Cooking Live with Gustavo, in which I email you the ingredient list, and then we get together and we cook together, or you just watch, either way. And there's one coming up on this Wednesday, and this is going to be a little bit different and nervous for me, because I have invited, this has never been done before, as far as I know. If you know anybody has done this, let me know. A whole food plant-based cook like me invites a regular traditional chef, a professional. This is a professional chef from a high-end restaurant here in town. He's going to come to my house right here, to my kitchen, and I'm going to show him. He doesn't have a clue of what whole food plant-based is, and I'm going to cook 3 things, and you're going to have the ingredients if you want to cook along, and we'll see how he responds to this. He may go, this is too crazy, I'm out of here, or he may like it. We don't know. If you want to be a fly in the wall, you're invited, and that is a show that's coming up. So if you want to sign up for that, you can email me and I will send you the link. And my email again is info@plantimus.com. I will also put it in my Facebook page, which I think it's already there. And at the end of this webinar, I'm going to play a little bit of piano for you as a way to end it. So for those of you who are new, we are reading The Cheese Trap by Dr. Neal Barnard, a brilliant book that all of us should have and should read, I think. So we are in chapter 5. We have covered half of it, and today we're going to finish it. So I am at the bottom of page 86, and it says conquering joint pain. So could a cheese sandwich make your joints hurt? Dr. Neal Barnard says. Arthritis is something we attribute to older age or maybe the genetic traits passed along from our parents. But rheumatoid arthritis is an inflammatory condition. Your joints do not just ache, they are also swollen and tender. And that means that something is triggering the attack. And if that is true, it means we should be able to track down the culprit and eliminate it. So then Dr. Neal Barnard shares Irene's experience. Irene was a nurse, and I'm on page 87 in the printed edition. And it says, okay, Irene lived in Richmond. She was young and had always been active, but she began to notice pains in her joints. Over time, the pain gradually got worse and was accompanied by stiffness, especially in the morning. It took her longer and longer to loosen up enough to get around. As time went on, it took a bigger and bigger toll on her life. So her rheumatologist started her on prednisone. That is a steroid that alleviates symptoms, but has many side effects: insomnia, digestive problems, and weight gain, among others, that no one would want to remain on that for longer than necessary. The doctor then wrote her a prescription of methotrexate. This is a drug typically used for cancer chemotherapy and is now commonly used for arthritis. It has side effects too. This is not to say that these drugs should never be used. They have actually helped many people, but even with drug treatments, Irene was still hurting and she wanted to get at the cause of her problem. So she was searching the internet and she found information about foods and joint pain. Specifically, she learned that a plant-based diet could help. So she presented the idea to her rheumatologist, and he said, "You're insane." But even without his support, she decided to change her diet. And, what did she have to lose? I mean, changing the diet won't really hurt. And she quickly began to feel better. And little by little, her pain started to disappear. And before long, she was able to walk without pain or stiffness. And she was able to ride a bicycle and do all the things that she enjoyed doing. Then Dr. Barnard tells us a story of Karen. She was 47, living in Ohio, when she started to experience pain and stiffness in her neck. And as time went on, the pain radiated down her arms all the way to her fingertips. And she saw her doctor, who ordered an MRI and took a good hard look at her bones and joints. Basically, the doctor said, I think we can help you. We need to do surgery, and this surgery is going to cost $50,000, which the doctor was, of course, ready to schedule it, and her health insurance was ready to write the check and pay for it. But Karen then saw a new doctor who encouraged her to first try a diet change. Aiming to reduce her inflammation and allow her body to heal, he advised getting away from dairy products. And while she was at it, she thought, why not give up all meat products in my diet? So she did. And same thing, within a week, she began to feel better. This pain started to subside. Within 2 months, it was gone, since she has not needed anything for pain, not even an aspirin or anything like that. So on page 89, Dr. Neal Barnard says, fighting arthritis with food. So arthritis comes in many forms. There's not just one form. And osteoarthritis is a common condition usually attributed to wear and tear on joint, cartilage, and bone. Rheumatoid arthritis is an autoimmune disorder. This is very different, meaning that the body is making antibodies that are attacking the body's own tissues. It causes inflammation in the joints of the hands and the feet, eventually working its way to the wrists, elbows, shoulders, ankles, knees, and hips. The joints are tender and swollen and often stiff in the morning. Psoriatic arthritis is a condition of painful joints that sometimes comes along with scaly, itchy skin, a condition called psoriasis. If you have rheumatoid arthritis, psoriasis, psoriatic arthritis, or any kind of inflammatory condition, don't walk to a dairy-free, plant-based diet. The researchers have long known that these conditions follow a geographic pattern. There were historically, they were rare in Japan and China and common in Europe and North America. You would not find much cheesecake in Japan and China, at least not traditionally. That goes for dairy products in general. They were not part of the culture until, the westernization was introduced, and now they're having the same kind of issues. So researchers have long noted that foods contribute to rheumatoid arthritis, and that diet changes can help. Back in 1991, researchers in Norway tested a dairy-free and meat-free diet in a group of people suffering from rheumatoid arthritis. Within a month, participants found that their joint swelling and tenderness had improved, and their morning stiffness was better. Blood tests confirmed that indeed their inflammation was subsiding. Also, Dr. McDougall found that inflammation can improve within just 4 weeks on a low-fat, dairy-free vegan diet. Pain, stiffness, joint swelling, and tenderness all improve. So if you do have any joint pain or issues or arthritis, you might want to consider a change in diet like the one that Dr. Neal Barnard it describes here, or like any other, like Dr. McDougall or many other doctor that follows and recommends a whole food plant-based diet. So now let's talk about tendonitis, which is a scary word for us pianists. musicians in general. I think about pianists because tendonitis can ruin a career. I don't know if you know, but there was a very famous pianist, Leon Fleischer, who suffered from this severely and had to stop performing for many years. So, tackling tendonitis. Foods may also affect your tendons, those fibrous bands that connect your muscles to your bones, like the Achilles tendon that attaches your calf muscle to your heel. When they become inflamed, the condition is called tendonitis. So the problem is usually chalked up to overuse. Yes, I, as a musician, have heard that many times, that you're overusing or you're using bad technique, which probably could be, it could be one of the causes. But something else is clearly afoot. First of all, people with diabetes are prone to tendonitis, which suggests that something about body chemistry is contributing to the problem. And second, researchers from Australia's Monash University found a link with cholesterol, finding that people with tendon problems generally have more bad cholesterol. So no one knows more about tendonitis than David Carter. In 2014, he was a 285-pound pro football player, and he was hurting. His tendonitis was so bad that he could barely lift himself out of the bathtub. One day, watching a documentary about nutrition and health, he learned that dairy products might be part of the problem. In other words, some of the very foods he had been eating to bulk up might have contributed to the inflammation. So he scraped them. He adopted an entirely vegan diet and his life transformed. Within 2 months, his pain was gone. His speed and strength improved. And then his only problem was maintaining a linebacker's weight on the world's most effective slimming diet. In 2016, the Green Bay Packers quarterback, Aaron Rodgers, announced that he was eliminating cheese from his diet. What would make the cheesehead's favorite athletes dump dairy? I just wanted to get healthier, he said. At age 32, Rodgers was eager to extend his career, and cutting out dairy products was part of his healthy eating plan. So through your eating, you can reduce inflammation, he said. And with a knee condition I've had a long time, it really started after the surgery. Thinking about exactly what I'm going to eat the first couple of weeks after surgery to kind of limit the amount of inflammation in my knee and carry that around the rest of the off-season. I want to highlight the word inflammation here because the word inflammation is a word that we should get familiar with because it's a very is a bad word. Inflammation causes a lot of health problems, from arthritis. If your arteries are inflamed, then that is part of heart disease. So inflammation is something that we really don't want to have in our body. All right. So again, be aware that tendonitis might improve if it's something that you're suffering from. Might improve if you switch your diet. Healthy skin on page 92. I have a webinar in my YouTube channel. If you go there, you will see that there is a webinar that is specially is all about acne, and with 2 adolescent girls that have an incredible story to tell. And I think that it would be worth watching it. So, healthy skin. What about your skin? If cheese and other dairy products can affect your lungs and your brain and joints, could they also inflame your skin? Could they contribute to acne? And so here, Dr. Barnard tells us the story of Amy, who was 5 years old, and she was dying, and the doctors also thought that she was dying. She had a Happy Meal at a McDonald's in Pittsburgh, and quickly she started having some bad symptoms like dizziness and nausea and diarrhea, and they worsened quickly. And the parents took her to the emergency room, and she was admitted to the hospital, and it just went downhill from there. Her kidneys failed. She needed dialysis. She really was on the verge of dying. The doctors didn't think that she was going to live, but she did. She survived. And so once she was out of the hospital, one day her father or family went on a drive through the Pennsylvania countryside, and rounding a corner, her father suddenly slammed on the brakes because a cow was crossing the road, and they were inches from an accident. So Amy, the 5-year-old, realized that the cow could have died just like she could have died. And she thought about how the cow was destined to turn into a hamburger. And so that day, this 5-year-old decided to stop eating meat. That was a good move, but like many other vegans, she started eating unhealthful vegan food. She said, I was eating pizza all the time. I was eating Doritos and junk food, and she did not feel well. At age 14, she made another decision: out with the cheese, milk, and other dairy products, and in with soy milk and rice milk. She stopped her pizza and with cheese, and she topped the pizza with veggies and tomato sauce instead of cheese. And of course, within a few weeks, everything started to change. Her skin cleared up, her bloating and other symptoms were gone. It was outstanding, another outstanding story. And at the bottom of page 94, we have dairy products and acne. So until fairly recently, most experts discounted the role of foods in acne. It's not cheese, chocolate, or grease that causes pimples, they said. The problem is hormones. And true enough, hormone shifts contribute to the breakdown. So the question is, where do these hormones come from? Well, I guess you probably, if you've been reading the book, you know that these extra hormones in large quantities are coming from the dairy products. So in 2005, Harvard researchers asked more than 47,000 nurses about what they had eaten as adolescents, and if they and whether they experienced acne or not. So the food that lit up in the statistics was milk. The milk drinkers had more acne, and how much of a problem it was dependent on the fat content. And this is where it gets very interesting. Those who had whole milk, full fat, were about 12% more likely to have had severe acne. But those who had skim milk were 44% more likely to have had severe acne. It goes from 12% with whole milk to 44% more chances if you're having skim milk. In other words, fatty milk was not a problem, but low-fat milk seemed to be a much worse problem. So then they did another study that addressed the issues more directly. They followed 4,273 boys and 6,094 girls aged 9 to 15 over a 3-year period, watching their food intake and whether they developed acne or not. The results mirror those of the earlier study. The more milk the children drank, the more likely they were to have acne. And again, skim milk was much lower in fat, obviously, but it is higher in both protein and sugar. And that seems to be the problem, even though the science of food and acne is still in its infancy. But the common experience of people who have dumped dairy and found that their skin improved suggests that going dairy-free is well worth a try. So what is another problem that can be diminished or eradicated by stopping the consumption of dairy? Well, guess what? Better digestion. So on page 96, Dr. Barnard talks about, at the bottom it says, although researchers have long known that dairy products can contribute to constipation in young children, many pediatricians have somehow missed this message. Not until Anne was 42 years old did a doctor suggest eliminating dairy products. And as soon as she did, her digestive problems became a thing of the past. So if you suffer from constipation or bad digestion, you might want to try to stop consuming dairy products and see what happens in just a few days. And on page 97, we're just at the end of the chapter, we have preventing type 1 diabetes. I find the topic of diabetes a very interesting topic. Well, first of all, because there was and is diabetes in my father's side of the family. But it's just such a horrible disease. It destroys the organs from the inside out. And the person most of the time doesn't feel anything until it's too late. So type 1 diabetes. In this condition, the pancreas no longer makes insulin. Now, I don't know how much you know about insulin, but to put it simply, insulin is a hormone. Okay, so what does this hormone do? Well, this hormone moves glucose, which is sugar, from the bloodstream into the cells of the body. And without insulin, glucose would build up in the blood. And that obviously is not a good thing. Usually diagnosed in childhood or early childhood, adulthood, the disease increases the risk of heart disease, visual impairment, loss of kidney function, amputations, and other serious problems. Insulin injections are essential for bringing it under control. For many years, researchers have known that infants consuming cow's milk formula have a higher risk of developing diabetes compared with breastfed babies. And goodness sake, isn't this something that we all wish that the population at large knew? That researchers have known that infants consuming cow's milk formula have a higher risk of developing diabetes compared with those babies that are breastfed babies. Presumably, the baby's immune system recognizes cow's milk proteins as foreign. Yes, and this happens with adults too. The body recognizes that protein is not human, and so it reacts and it creates antibody against them. They're not supposed to be there. These antibodies, in turn, attack the baby's own pancreas, killing off the insulin-producing cells. In 1992, the New England Journal of Medicine, it is a reputable publication, reported the results of tests of 142 children newly diagnosed with type 1 diabetes. Every single child had antibodies against cow's milk proteins. Every single child. In further tests, a portion of the cow's milk protein turned out to be a biochemical match for a protein in the insulin-producing pancreas cells. So a pilot study looked to see if avoiding cow's milk formula might prevent type 1 diabetes. It included 242 newborn babies who were deemed to be at risk of diabetes. Researchers encouraged their mothers to breastfeed, and then when the mothers were ready to transition their infants to the bottle, the researchers asked half to use a special formula in which dairy proteins were broken up into individual amino acids. The other half were to use a regular cow's milk formula. And they followed these children through their first 6 to 8 years of life. The modified formula did indeed appear to have some benefit in reduced diabetes risk. As of this writing, however, the full test results are not yet in. But Dr. Neal Barnard says that they should probably have gone a step further. He thinks that in this pilot study, they should have, he says, this pilot study restricted dairy consumption only during the first several months of life, and it did not ask the breastfeeding mothers to avoid cow's milk in their own diets. So the mothers were still delivering traces of cow's milk proteins to their infants every time they breastfed, and giving their children dairy products later on. If dairy proteins are a culprit in type 1 diabetes, the way to avoid them is to, number one, steer clear of dairy products through childhood, and number two, ask mothers to avoid dairy products while they are breastfeeding so as to avoid passing dairy proteins to their children through breast milk. And of course, cheese is at the top of the list of products to avoid because it has particularly concentrated milk proteins. So that is the end of chapter 5. And next week, we will start chapter 6, which is about heart disease, diabetes, and the French paradox. Now, if any of you have any questions, comments, please type them. I'll do my best to answer. If I don't have the answer, I won't make up one. I'll just either look for it. I will ask one of my doctor friends, and I'll bring you the answer next time. But these are very common conditions that we have talked about today. Arthritis, rheumatoid arthritis, tendonitis, acne, problems with digestion, what else? Diabetes, type 1. So they're all related to this topic of dairy and cheese. Of all the dairy foods, Of course, cheese is the most concentrated, and we've been reading about that for the previous 5 chapters. And so we want to avoid them. And if you know anybody, just tell them that what do they have to lose? For a week, stop eating dairy entirely, and then see if they find that they have drastically improved, then there is an answer. So I will see you all next week. Let's see if I have last minute announcements. As usual, well, not usual, sometimes I play something for you here in my piano. For the last 2 webinars, I have had a guest who has made a cheese sauce, and you might want to go and look at those last 2 sessions in my YouTube channel, and they were really amazing. If you're watching me here on Facebook and would like to be in the book club, it's free and open to everybody. You might want to email me. I'll email you the link and you can sign up. Thank you very, very much for joining me today, my audience of Facebook, my audience in Webinar Jam here. And how about if in this Saturday afternoon, we enjoy a little bit of calming and music, something that, will take us to another realm. We all live in this world right now where it seems that we are in a constant commotion, and no matter in what area. And sometimes it may seem that there's no hope, but there is hope. And we need to know that the world is good. There's a lot of good things. We all have wonderful things and wonderful people in our lives. And I hope that this music will be a little bit of help in relaxing and getting away for a few minutes from all of this that is going on.